Thank you, Governor. I've been in healthcare a long time, and you did it very well. Wonderful speech. And thank you all for inviting a boy from Southern California up to Northern California. Barbara Hines is our executive VP. We have our visas, and we're always glad to be in San Francisco. I'm going to be short. One, what the governor said is absolutely true. The system's broken. We need to find ways to fix it. Groups like this help define it and help put some wedges in to make a difference, because the special interest, as the governor talked about, are huge, and trying to move the system is very difficult. We want to talk a little about, or I do, what we're doing in Los Angeles, doing some modeling. QueensCare is a public charity, a 501c3. Some time ago, 10 years ago, we sold the hospital and created an endowment. And that endowment allows us to do work in healthcare. And we do it in Los Angeles County. This was negotiated with the Attorney General, and so it's only in Los Angeles County. We have a partnership with QueensCare Family Clinics, which is a group of community clinics, federally qualified health centers. And our mission is to serve the low-income, uninsured, or underinsured. And you heard the governor talk about those. Remember that gap we talked about? You have the private insurers, you have Medicaid, you have Medicare. We fill that gap. And what we do is provide care to a group of individuals that really fall through the cracks. And we don't ask questions about their status, we just take care of them. And we've learned quite a bit about taking care of the poor. 16% of the patients we treat, and we have a health and faith partnership with the parish nurse program, does community case management, counseling, and they do health screenings and then referrals. About 60,000 encounters every year. And they work in churches. They put a shingle out and then take care of those individuals that come through. Through our clinics, we do 135,000 visits. So, and then, as the governor said, there are visits you can't count because they aren't paid. We do probably another 40 or 50,000 of those. And they're in the prevention zone. And nobody wants to hear those statistics because they're not paid, but we do try. So we over 250 to 300,000 encounters in central Los Angeles. 60% of our patients have chronic diseases. Huge. We send our data to the feds because we're federally qualified health centers. We're in the 90th percentile across the nation, even in California. Diabetes, we're in the 99th percentile. These individuals present to us constantly, and they need a lot of care. When they walk out the door, they'll probably have 5 or 6 prescriptions that they need to be filled. And depending on whether it's Medicaid or another program, either we fill them or the government fills them. But it's acute care medicine. We only take care of them when they're here. Now, we are doing some things. We have case management. These are individuals at each of our clinics and our parish nurses in the community that follow these patients, try to work with them to take care of them and work with them at home, at the hospital, in the clinics. But nobody pays us for that. We do that gratis because the model has to be changed. Acute care medicine is not where it's at. We've got to flip it and put the money in preventive medicine. We've got to do it, both health education and prevention. Because it's genetics and it's lifestyle. The governor said when it gets to acute care medicine, it's not a big percentage. So we've got to make a change. And it's hard to do because all the interests aren't wanting to pay us or anybody else for doing it. But it's about following the patient through the systems. We have some interesting models we're dealing with. We're developing a pediatric disease management model with Los Angeles Unified School District, which is probably one of the largest in California. It's about 750,000 kids. And we're going into schools and working with them. And we're identifying those kids with asthma. And we're then going to track them through the system. We'll also work with them at home, looking for the triggers for asthma. Asthma is one of the major reasons they miss school. So we're going to assign what we call community health. These are individuals out of the community
high school graduates trained for about 5 to 6 months. They receive about $15 an hour, much different than an RN. But they're out of the community, know the community lingo and the culture, so they can work with the community, and the community trusts them. They go out and they talk, and we've seen changes. One quick vignette, we had a young girl, this came to us from, I think, Washington, D.C., African American. She had been in Children's Hospital over the last 12 months, 20 times. We believe in a medical home. You gotta have a medical home where you can track primary care. She was referred to us. We have a relationship with Children's Hospital. We take for asthma the frequent flyer kids. We have been in the ERs a lot. This young girl now, over the past 6 months, has had no ER visit. That's huge. You know what ER visit at Children's Hospital costs the system? It's unbelievable. So it's just somebody taking the time to manage these individuals. And it doesn't have to be an MD. I don't even think it has to be an RN. It needs to be somebody trained that can communicate in the language and understands the culture. We're also working with LA County USC. We're implementing an electronic health record. We had a pre-meeting. We believe that electronic health records are the wave of the future. They're going to help us enact and over time make a huge difference in what we do. But for 7 clinics, about 40 physicians, 180 people, $3 million. It's huge cost. We had some state money, and QueensCare as a public charity and a partner put in some more. Most community clinics can't do that. Most private doctors' offices can't do it because they look around and say, where is the return on investment? It's not going to be immediate. It's going to be 5 to 10 years. Again, as the governor talked about, as we control more of the population and we can track the people from their private docs to clinics to the hospital to the ER or wherever they're at. It will make a huge difference. We know our patients shop physicians. We know they visit ERs. They will often use their ER as a medical home. We're trying to disrupt that. One of the biggest hospitals in LA is LA County USC. It is the home for the industry. And we have set up a relationship. We have now been able to hook with their internal EHR system with our clinic system, and we trade data. And we are assigned case managers. We're taking about 60 frequent flyers out of their emergency room. These are people that have been in the ER for 1 year, more than 20 times, and assigning a case manager. And this case manager only has 30. They truly live with these patients. And the goal, and we've actually seen that they've reduced the ER visits. So, as the governor said, it's about a change in the system. Again, the built-in special interests aren't really interested. I work with a lot of insurance companies. I sit and listen to what goes on. It's not about quality of care. Believe me, we said in these board meetings, it's about, see, patient X, you know what, we need to get him or her off the rolls because they're costing us too much money. So it's about return on investment. It is not about quality of care. I have not heard a quality of care discussion in these meetings. That's crazy. You then have to make a change in the system. And it's people, again, like you that will do it. You've got to drive a wedge in the system. You've got to start educating. As we heard in the small session, it's about truth. Somebody's got to say the emperor has no clothes. Politicians don't want to do that because they may not be elected next year. So, you're doing great things. Please continue. We are developing models that are trying to help you do what you want because we'll take them to the policy models and say, here, this works. It actually saves money for the system. Because otherwise it's a budget neutral exercise and we'll just ride it off. Thank you. And I'll be open to questions also.